Hello, I'm Alexandre Moda, and in this video I'm going to start talking about a topic that a lot of people have already asked me about. People keep asking me, and I just keep giving guidance. Watch this video, check out that structure, right? But now I'm going to talk specifically about dorsalgia, upper back pain, pain between the shoulder blades, pain in the ribs, in the back, obviously, right? And in this first video, we're going to talk about those trigger point pain, the tension between the shoulder blades and here in this muscle above the scapula, the shoulder muscle called the trapezius. The scapula is a triangle with the base, the wide side at the top and the apex at the bottom, and behind, actually in front of the scapula, between the scapula and the ribs, there's a muscle called the subscapularis muscle. This muscle, when it's in spasm, when it's tense, and it already has a certain tendency for that, it hinders both the movement of the arm, the humerus, the actual shoulder joint itself, but it also pulls the scapula outward. And when it does that, all these muscles that connect the scapula to the spine, or the scapula to the thorax, or the scapula to the cervical spine, tend to end up in a non-functional situation, a bad situation, as if they were quote-unquote too stretched out, okay? And when that happens in this region between the scapulae, in this region of the trapezius, or above the scapula, or even a little below, it usually accumulates tension, causes pain, or those famous trigger points, or those painful knots, right? And a lot of people struggle with this. They do stretching, massage. They try to use some technique to eliminate these trigger points when in fact the problem is here in the scapula. And just to recap, imagine that I reached in here and took out my scapula. This is the back part and this is the front part of the scapula, which is between the scapula and the ribs. This is where that little muscle I mentioned comes from, called the subscapularis, which pulls the scapula outward. To do this inhibition technique, work on the subscapularis and relieve that whole area of pain, discomfort, and increased tension. We're going to grasp the scapula like this, with the thumb going between the scapula and the ribs and the other fingers staying behind. For this, if I want to work on the right scapula, I place my right hand on my left shoulder, the scapula will be here. I'll do exactly what I said. Watch. Thumb goes in, wrapping around the scapula. Don't go too far toward the center or ribs, okay? Wrap around the scapula and this arm that's on top, just relax it. And with your finger, look for a tender spot. Go slowly, because this muscle is usually very tense. Even if you don't feel pain in this area, sometimes when you press it, it may catch you off guard. So be careful, press gently. Look, grasp around it, relax the arm that's on top, and with your thumb, look for a spot that's more tender. You can go in deeper and apply deeper pressure, as if you were using your thumb to separate the scapula from the ribs, or you can press the muscle itself, looking for a more sensitive spot on the inside of the scapula. When you find that more sensitive spot, you can work in two ways. The first way is by doing a gentle circular massage, keeping the pain as mild as possible. Do this massage until you feel the muscle itself become more relaxed, softer, and the pain decreases. The second way to work on this sensitive spot, to work on this muscle, is through ischemic inhibition or the Jones inhibitory technique. What are you going to do? You will press the spot, keeping the pain as mild as possible, just a slight pain. And take the opportunity with each breath as you exhale to relax your upper arm more, relax your shoulder more, let your shoulder drop to the floor. Keep this pressure until the pain subsides, or keep the pressure for 90 seconds, whichever comes first. After you've looked for 1, 2, or 3 painful spots and done the work, deactivating those points, you can test the tension in those muscles again. Look for the trigger points and check the freedom of movement in your arm. For most people, all that band of pain and tension from the trigger point disappears like magic. If that's your case, I want you to do the following. You've already understood the message that your body, your subscapularis, needs to be released, needs relaxation, that your daily activities, your habits, your posture, your lifestyle habits are causing a buildup of tension in this muscle, okay? So you're going to set a time during the day, choose a time when you're free, whether it's when you wake up, after breakfast, at night, during lunch, anytime. Whenever you're free, set an alarm on your phone and have that alarm repeat every day. When the alarm goes off, you go and perform the inhibition technique on this muscle, just like we learned today. Depois, afterwards, notice how much your arm, your shoulder, your body feels more comfortable, freer, and healthier. Here's another tip. It helps even more if you say this out loud. Look, my arm is much freer, my shoulder is looser, I can feel my whole arm, all the pain and tension I had are gone. I just gave my body more health, more comfort, and a better quality of life for myself. It might seem silly to say this out loud, but when you say it out loud, you're bringing it to your awareness, your attention to that aspect, and this will help your body maintain that well-being for a longer time. And it will help this habit settle into your routine more quickly. Another thing is that if this worked for you, if it brought relief, if it made those trigger points, those painful spots disappear like magic. So you talk to the person, to the professional physical therapist, doctor, or Pilates instructor who's following your case and say, hey, I saw a video by Dr. Alexandra Mota on the internet where he talked about the Subscapularis. He taught me a way to test and relieve it. When I tried it, it got much better. Alexandre, why should I say that? Simply because this information can help guide your treatment better. And if you like this video, if it helped you, if there was any new information, share it with 2 people. Think of 2 people who need this, who feel pain, who complain about pain or tension in the shoulder, shoulder blade, or neck area. Upper back pain or dorsalgia, which is the topic we're discussing now, and send this video to them. You can copy the link, send it through Facebook, or tag them below if you're watching me on Facebook. Tag them below if you're watching me on Instagram. Or you can send the YouTube link here if you're watching me on YouTube, by email, by WhatsApp, wherever you want. The important thing is that you get this person to watch the video, because that way you can really help improve their quality of life and health. So I'll stop here. Big hugs and see you next time.